if there is a patient who has had a previous blood clot, let's say a pulmonary embolism in the lungs, and is no longer taking blood thinners, and let's say they've developed a bit more chest pain or some difficulty breathing, should they go to the emergency department in case this is another blood clot? What do you think?
So I'm glad you asked this question, Jim. This is a really important question. So the scenario is if you've had a pulmonary embolism previously and you've got chest pain or difficulty breathing again, do you really have to go back to the emergency room and potentially expose yourself to coronavirus or people who are suspected of having the infection? I would strongly advise you not to downplay your symptoms and assume that it's something not to worry about. These are worrisome symptoms, and you should seek medical attention, preferably urgently, including the emergency room if necessary. The problem is that, yes, this could be pulmonary embolism, but this could be something else. This could be a heart attack. This could be something else causing chest pain. And that needs to be sorted out very, very quickly. You should keep in mind, we've been dealing with the coronavirus now for months, and there are protocols in place in most emergency rooms to segregate patients who are suspected of having coronavirus infection, to ensure social distancing to the extent that we can. And there are screening protocols in place when one enters the emergency room nowadays to provide protection. And the other thing that I mentioned is that there is evidence now suggesting that for some reason, with the onset of coronavirus pandemic, that we're seeing fewer heart attacks reported, both in New York City and in Italy, for example. And that suggests to me that potentially people are ignoring their symptoms, and that's a big problem, because we can't forget that chest pain and shortness of breath are things that should be taken seriously.
Right, and just to emphasize to the audience that really the hospital environment has seen a tremendous change in how it helps in the assessment and management of patients to ensure that those with COVID-19 and are properly managed, but equally important to allow people to feel safe to come to a facility, especially if they're having symptoms like chest pain that might be a heart attack, or shortness of breath that might be another blood clot. So I think there's a message there to not delay and be reticent to seek medical attention, especially when there are effective and safe treatments available.